and we take care of family caregivers. Family caregivers that are unpaid. Family caregivers like you and I. There's an estimated 490,000 family caregivers in our county alone. That's like filling Petco Park 12 times over. And Southern Caregiver Resource Center, we started in 1987, and we were founded, and we are still the leading provider of caregiver support services for families. We serve over 100,000 families annually through education, through care planning, case management, counseling, much needed respite care, support groups, and all of our services are free. Our family consultants, they work with the families like you and I who are caring for a loved one with maybe Alzheimer's or just a frail older adult with other chronic diseases. And they assess their needs. They help them develop care plans. They connect them to the programs and services that are out there that they're eligible for. Well, with these proposed cuts, those safety gaps, those programs that families need to stay at home and be caregivers, they're going to be going away. And so it's going to be an unimaginable task and burden on a family member who is already overstressed, overworked, not getting paid, and having a massive, massive financial hardship on themselves. So with that, I want to just say that we need to educate and advocate our most vulnerable populations and let our elected officials know that they should not make these cuts. Tell them to keep their hands off of Social Security, Medi-Cal, and fund the Older Americans Act. Woo! These programs are the lifeline of millions of Americans. Thank you very much for being here. And now I'd like to introduce my colleague, our Vice President, our Executive Vice President, Marta Rañón with Southern Caregiver Resource Center.
Woo! Woo! Thank you so much for the opportunity to talk about the importance of these funds that affect so many in our community, especially family caregivers. At Southern Caregiver Resource Center, we see our caregivers give so much of themselves at a great loss and sacrifice, not only to their jobs, to their families, but also to their health. Caregiving is not easy, especially when caring for someone who is unable to care for themselves. Many grandparents in San Diego County are caring for grandchildren. There are so many parents who are struggling to make ends meet. There are children who depend on childcare, on community programs to keep them safe. And there are so many seniors facing chronic and debilitating conditions who rely on Social Security to supplement their fixed income in order to just live. There is an erroneous belief that Medi-Cal, IHSS, Social Security funds are unnecessary, that these funds are being wasted. Let me tell you, as a person who grew up depending on these community services, as many of my colleagues here work for and offer in their communities, as the caregiver of an elderly woman who rely on every penny she had just to survive, these funds are a lifeline. I have seen firsthand how enriched we are when we take care of our most vulnerable. That is why at Southern Caregiver Resource Center, we focus on caring for those who care for others. But we cannot do it without these crucial funds. So join me in saying no to these cuts. No to these cuts. No to the elimination of funds to the Older Americans Act. No. No to turning your backs on the most vulnerable. No.